Welcome back. If you just happen to tune in, this is Rise and Shine. Well, prior to the break, we did mention that we'll be having a guest on board to talk about a very important topic that is happening, that is currently prevailing in Sri Lanka. Because from the beginning of the show, we did talk about the health benefits, what you should do, what you shouldn't do, and so many things like that. So this segment is also with regard to some of the health benefits, some of the things that we should be very, very mindful and be careful of. And we all do know that there's, heat, very bad weather that is prevailing in the country. I would say heat waves. I'll be right in that sense. To talk about that, today on the show, we have Dr. Priyanka Rajawardena, the consultant physician. A very good morning, doctor. So, doctor, start things off now. The current condition in Sri Lanka, the heat waves. What would you really like to talk about that, or why is that happening? If you could just briefly explain about that.
Yeah, it's more than the heat wave. I think the hot weather, and everybody feels that
yes,
the country is very hot these days. We have been experiencing this for some time. In last year, and in 2018 and 2017, also we got the same problem. Yeah, especially in the February, March, and April.
So that's a season that generally
it's
happens.
the season,
okay,
and it will be there until the monsoon comes in the mid-May.
Right.
I think it's due to the wind pattern and the dry wind created in the interior of the country, and it doesn't move fast, keeping the country warm and keeping the high humidity in the coastal areas. So we feel it very badly. It could be due to the effects in the Pacific and Indian Ocean also, but people in the country feel it very badly, and we get lots of patients also related to the heat problems.
right.
All right. So, doctor, now one of the things that you mentioned is you get a lot of patients. So, is there like a high risk segment in our population, or like people especially who work outside, people who do like school children who go to work and school, and parents? So, is there like a high risk selected people?
We don't experience conditions like Middle East or hot part in India or Pakistan, but we do feel it, and people comes with some people work outside. The high risk groups are the small children, elderly people, people who work outside, the laborers and farmers. They have to work. And the people who have chronic medical problems, and maybe the street vendors, people
and homeless people.
Yeah, and homeless people. So they are the victims, and school children are the worst category. We don't get big medical problems, but we get lots of people with heat rashes, that the prickly rash-like thing, and the cramps. People complain of leg cramps these days, the body cramps. That could be due to the dehydration and losing various minerals and water from the body. And on top of that, if they are taking kind of medication to lose, get rid of water from the body, in the way of urine, they comes with cramps. And people come and say they are exhausted. It's exhaustion. It's a part of the effect of the high heat, and some people get stressed out. That stress is again could be due to the heat and exposure to the high temperature. And some people come with syncopal attacks. Syncopal means the fainting attacks.
Okay.
It is that happen when they expose to the high heat and when they stay outside. There's a dilatation of blood vessels and the leaking of the fluid outside from the blood vessels, and the dehydration and losing minerals from the body. So they come with the fainting attacks. So those are the common symptoms and common presentation. Heat stroke or sunstroke is not very common, but if the same weather is continuing, then we have to think about it, and we should the hospital should prepare for those things and educate the staff how to manage heat stroke or sunstroke, as it is a a medical emergency. So in sunstroke, what happened when they exposed to the or heat stroke to the hot weather for a longer time, then they obviously they lose the water and get dehydration, lose minerals like sodium and potassium and those kind of things with setting, and then they get starting with cramps and aches, and then get dry skin. And special features of sunstrokes are the dry skin. The skin is very dry and red and warm, and they lose the body lose the thermoregulatory action of the brain, and the body temperature goes very high. It may be more than 40 or 41 degrees Celsius. Then they get agitation, confusion, they vomit, and sometimes they could get fits even. So then they should bring to the hospital immediately. But before taking them to the hospital, there are things which people could do. First thing is keep them in they have to remove all unnecessary clothes, because to make the body
Cooler.
And get them to a cool area, maybe a shadow place, and if there's a facility for AC, the air conditioned place, or wherever a shadow place, in a cool place. They can put some ice in the axilla and the groin area and make them cool until they come to the hospital. We have to rehydrate them, giving plenty of fluid. Oral rehydration solution is better than pure water, and things like king coconut and maybe citrus fruit juices like lemon, that kind of things. And they can put a fan with a bowl of water, and they should avoid giving alcohol and coffee and tea and
Any of
sugary
those
drinks.
Which are kind of because of they're dehydrating? Or?
Yes, they can make the dehydration worse, especially with the sugary drinks, maybe coffee and tea and alcohol. And so when you expose to the heat, what we advise people to drink lots of water and maybe king coconut and citrus type of juices, but to avoid the sugary drinks and coffee, tea and alcohol. And when they come to the hospital, we should carefully cool them and rehydrate them, and then manage the other issues carefully, especially the electrolyte imbalance. Heat stroke can cause even to the death, and some people may be having residual neurological impairment, that may not come back to near normal after that.
So, doctor, now when you talk about this, the symptoms and that what people get, we have so many categories of people. We have the infants, and then we have the adults, teenagers, and as we go on. And I believe for these different categories, it affects in different ways, because definitely the older people, they cannot take it up that easily as the younger generation does. So, how can they be really careful if you take the different categories? How would you like to advise them to be, on the safe side of it?
Yeah, good. First thing is because we have to understand this is hot season, so people should drink more fluid. Though they are not thirst, still they have to have excess amount of fluid, not very excess, the more than normal. And they should give the priority to the water, maybe king coconut, and water and king coconut are the best, and avoid sugary drinks. Then they should stay indoor, as much as possible. They should not go out unnecessarily, especially the elderly people and the infants. And we should not keep them outside. Then if they go out, they should wear a hat or umbrella, and people who could afford, they can put a sunscreen, good sunscreen with 30 plus strength, and they should apply it at least 30 minutes before exposed to the sun.
Right.
And wearing sunglass is a good practice because people say the ultraviolet radiation effects on eye. And if they have to go out, they should take breaks. They should go to a shady area or AC place or cool place whenever possible. And some people, they have to work outside, there's no choice, like farmers and
Definitely,
laborers,
yes.
and street vendors. So they also should do the same, drink lots of fluid, and should take breaks frequently, and go to a shade whenever possible.
Probably
And
they
if
should, I
there's a
think.
choice, they should, if they have to do something outside, they should avoid the hottest period, that is 11 a.m. to 3 p.m. But if they can do those things in the morning and dusk, so that is the best time if it is essential.
Yeah.
And when it comes to the school children, I think the education department and the health ministry, there are certain rules and guidelines, and they should avoid sports meets, that kind of things during this
physically
period.
taxing events.
Yeah, and they should keep the children inside. And when they go to school, especially children, they should keep a good water bottle, big bottle,
Yeah.
and they have to have a good amount of food, especially starchy food, then proteins, maybe fruit juice like lemon or citrus kind of thing. And the other thing, that some part of this country, that after the school they come home walking, and especially the north and east
Yeah.
and central area. And other thing is the money and the poverty, so children have to walk miles and miles because may not be having transport. So we have to educate the parents to give the children good amount of water, and give umbrella, hat, and those things. And education department should take measures for their protection. And still we get children that go to school, and even last week we got a few children participates in events organized by the school, and we have to educate them not to do that, as it is a very hot season. Postpone those events until at least mid-May.
Right.
One of the other things that I wanted to talk to you about, Doctor, is that I think when we were having a discussion earlier, you happened to mention that there's kind of like a small outbreak of influenza which may or may not be connected to these warm weather.
Yeah.
Do you want to?
Well, influenza is a seasonal illness, and these days, luckily, we don't have many dengue patients. But influenza is common. People come with fever, headache, joint pains, chills, and sore throat, and nasal discharge, and cough. So if somebody is having these symptoms, whether the influenza antigen, that's a blood test or sputum test we do, if it is negative, you can't say it is not influenza. If somebody having fever, joint pains, muscle pains, sore throat, cough and nasal discharge, that is influenza. So people should take precautions, because what happened, children get this kind of illness commonly, and they get it from the school or Montessori, and usually they are okay, they are immune to that. And when it get to the elderly people, like their parents and grandmothers and grandfathers, they will be the victims, because they are high risk, and especially the pregnant women. In our practice, what we have seen, young mothers, when children get it influenza, she has to take care of the children. They stay at home until last moment and come to the hospital, and we had a few deaths related to influenza among young people. So they have to be careful. They should seek medical advice. If this is just a cough and cold, no point taking antibiotics, because it is a viral thing. And best thing is, if the person is having high fever, cough, and difficulty in breathing, that's a very bad symptom. They should get admitted to the hospital soon.
So, doctor, that also brings me to a question now. You did mention about that the some parts of the region, they obviously don't have any choice, but rather to walk maybe miles and miles away in their day's work. And then also on the other side, maybe people like the fishing communities or the farmers, they have to, I think, do a bit more extra work than the normal people will do in their day-to-day lives. So, will they have to do something extra in this particular period, or do they also have to do the same things as the other people would do?
Well, sometimes they may not have choice, that they have to work, otherwise they don't get their salaries or money. So if you could change their work pattern, like doing things early morning if possible and dusk, and avoid the exposure to the sun during the hot period, like basically it starts from 11 o'clock to up to 3 o'clock. So that will be a good choice. And if they have to be if they are exposing to the sun, always use at least a hat or umbrella if possible. And when it comes to the clothing, it should be lightweight, light fitted and light colored ones rather than tight ones.
Right.
And drinking more fluids, those are the things. Poor people can't afford sunscreen, etc. But people could afford get those things and sunglasses also, if possible.
Doctor, I want to ask you now, you work in hospital, obviously, you're attached to affiliate to a hospital, and then you get a lot of patients and you see a lot of people who are in very adverse conditions. Now, because of this heat wave, has there been like an alarming number of an increment of patients who have probably died or not?
Well, the situation is not as bad as we expected. The current situation, there's a thing called heat index, where we calculate the temperature, outside temperature and humidity. If the index is between 31 to 41, we think is high. If it's 41 to 51, we think is extremely bad. And we are in the 31 to 41 range, so we have to take precautions, and we don't get medical emergencies as such, but people come with odd symptoms like that. As I mentioned, rashes, cramps and syncopal attacks, a bit of confusion and stress and agitation, nausea, vomiting and those things. So most of the time we don't think it's related to the heat. We think it's due to something else. But these odd symptoms, those are related to the hot weather. So in hospitals, we are not facing a kind of an emergency-like situation like in dengue or influenza. But people complain those things, especially who come to the hospital. They also may not realize this is due to the hot weather. So still more patients, but the severity and they are not life-threatening issues.
Right. So, Dr. Now, because you mentioned about dengue, you also do have a certain set of dengue patients, but as opposed to that, these patients also do come in day-to-day's picture. So how would you really, if someone has really gone through this heat wave condition, and if the same person is going through the dengue as well at the same time, how would you really treat them, because that is a different, I would say a different sickness altogether, as well as this is something else. How does it go hand in hand, and is it a very serious issue that you really need to think about, or?
Well, we are very used to dengue presentation, and when somebody comes with fever, joint pains, body aches, and headaches, without cough and cold sore throat, and we think this is, unless proven otherwise, this must be dengue. Heat-related things, we don't get heat strokes much. It's basically there's a clear history that they exposed to the sun previous 24 hours, and they come with the real story. Otherwise, that means working outside or maybe participating in a school event, doing exercise, walking, that kind of thing. But dengue, we are very used. If somebody comes with fever, headache, joint pain, muscle pains, and pain behind the eye with fever, we consider it dengue. With these symptoms, if somebody, the same person come in cough and cold, sore throat and nasal discharge, we think it's influenza. So the hospitals are geared to that, and we have got our national guidelines, and
Right.
all over the country, the doctors are working according to the same guidelines. So I think we should not panic about it.
And the systems are in place.
Systems are in place,
Yes.
and the ministries.
All right. So I think that was a lot of good, important advice coming our way, coming your way through the doctor and Dr. Priyanka Jayawardena, consultant physician. And I think it was a really productive discussion we had, which you should immediately, whatever the doctor said, should be implemented. And with that, it's a wrap for us for today's edition of your favorite morning show, Rise and Shine. It's 6:30. It's 7:30. I beg your pardon. And we'll be saying bye-bye on this edition's Rise and Shine. We'll be seeing you tomorrow, same time.